Hey guys, welcome to a super cool episode of Mediocre at Breast. I have Lauren Daniels with us today from Flourish Family Chiropractic in Clear Lake, and we can't wait to chat with y'all. Welcome. Thank you so much for being here. You're probably so busy. I just know it, just being a mom, just saying mom, I already know you're busy. So thank you for your time. It's very precious, and I'm just so happy you're here.
Oh, I'm excited to be here. I was excited when you messaged me. I was like, yes, I do want to do that with you.
Yeah. We've always had so much to talk about. I mean, I don't know if anyone, of course, there's got to be some viewers who have been to a chiropractor before. It's pretty quick.
Right.
What I do like about your office, though, every time I go there, I say this to your your assistants that come in before?
Yeah.
Is that what they?
Yeah.
They're all lovely. I've always found a quick friend in them. Especially this week. We'll get into that.
Yes.
We got real close and personal. And it's never been like the usual chiropractic office for me, because a lot of them do like sports medicine, and it's very in and out.
Right.
And in out like less than 10 minutes.
Yeah.
And you're like, I guess I feel better.
Right. Like, rack 'em, crack 'em, you're on your way.
Exactly. Yeah. And I mean, that's a good selling point already, because the world runs so quick, and it's such a great start to wellness is what I'll say.
Right.
It's a great start there, getting everything in line and whatnot. And we'll get into like what exactly that helps. But I've always loved that you have someone come in before and ask, what is your trigger points this week? What's bothering you? Where are you in your pregnancy and your parenting? What are you physically, what's ailing you? What's stopping you from being able to play with your kid on the floor? Stuff like that. Something that's so important. Yeah. Because I talk about it all the time. Kids learn through play. And if we're not able to get knee to knee with them and feel good about it, we're not going to be 100% for them.
Totally.
And that's my goal in parenting, to be 100% for him. So I love that they come in and they listen to you. They work on whatever's hurting you. Mine is always my shoulder from breastfeeding or the night feeds. Yes. I sleep like this for some reason. And then I wake up every morning. I'm like, why did I sleep like that? Because that's the only way we can sleep in that like C shape.
Oh my gosh. Co-sleeping, like somebody lied to me. Okay. When I had my baby, everybody says, oh, co-sleeping, you're going to get so much good sleep. The baby's going to sleep so well. And I'm sure for some moms out there, that's true. And like, I really wanted to be that mom that got all the good sleep with co-sleeping. But for me, my baby's 1. She just turned 1. We tried it for the first like 6 months, and it was so painful. Like my body hurt so bad. I had to have my husband like tucked in a certain way and a pillow tucked in a certain way.
If they even get to sleep with us at all.
Exactly. But look, if you want to stay in the bed, here's your job. You are there to support this shoulder. Like, don't move. He's like, okay.
And then he has his own problems.
Exactly. Yeah. So then he'll be like, okay, well, I need a massage and an adjustment tomorrow. I'm like, okay, deal.
Yeah. So I just need 2 hours of sleep.
Yeah, exactly. So, I mean, it's beautiful. But then my baby also, for me, like when we were sleeping like that, she had to be latched on the whole time. And then if the boob fell out of the mouth, she was like frantic looking for the boob again. So like, okay, this is nobody's sleeping. Like she's not sleeping. I'm not sleeping. But yeah, no, that's what we love with the office. Like that's really what we wanted to create, was a space where we want to know our patients. We're coming alongside them in like the most important times of their lives, like prenatal, postpartum, even just motherhood in general. Like you have a 2-year-old, a 3-year-old, and an 8-year-old, like that's so much in your world. And just to be able to be a part of that and like be alongside those families and support them and help them nutritionally, physically, emotionally, mentally, however we can make a difference and an impact, that's our goal. And so it's really so much more to us than, you've got back pain or you've got a headache or whatever.
Exactly. And that's what I always appreciate. I started going there when I was 26 weeks pregnant and serving. So I was technically still sleeping at that point.
Right.
But, not comfortably, because you're pretty pregnant at that point. But sciatica was every week. I was like, my sciatica, and I'd never used that word in my life. And they also told me like, my OB was like, oh, as soon as that baby comes out, it'll be gone. Like my ribs didn't shift. Like all of that didn't change.
Right.
And I had horrible rib pain the whole time.
Yeah.
And it turns out because I took some time off of going weekly to chiropractic to do pelvic floor after, because I had a C-section.
Right.
So I was like, I feel like I'm way behind the curve because it took me a long time to accept that happened, basically. Because I was very, gung ho for that vaginal birth. Every mom is. And so once I accepted that, I was like already 8 months postpartum, and I was like, oh gosh. So I got in with Brittany at Empower and started working there, and that's where I learned that I have my ribs like tilted.
Oh yeah.
So when I look down at my belly button, it's interesting how that all
connected
affects everything. And I look down and I'm like, I don't have a C-section pooch. I have something different because it's like just my belly button, but it's like goes sideways.
Well, I mean, you're a very little person, right?
Yeah, it took almost nothing probably to mess up my ribs. But I spent my entire pregnancy saying my ribs were on fire and they were literally moving. That's why.
Yeah, they do. A lot of people will even have to get like a bra strap expander because their rib cage widens so much. I mean, that's things nobody talks about when it comes to like pregnancy pain. Everybody talks about hip pain and sciatic and low back pain. Nobody mentions ribs, and it's really, really an issue.
Yeah. And I felt like because of that, every time I said it, they were like, oh, okay. I was like, oh, that's great. I'm like, no, it's literally constant and I can't stop thinking about it.
Yeah, it's really, really rough. I mean, I had it with not so much with this pregnancy, but with my second pregnancy, I had terrible rib pain. And it's brutal.
Yeah. Was that your boy?
That was my first daughter.
Okay.
Yeah. My boy is 14, about to be 15. My second is my daughter, and she's 7, about to be 8. And then I have the 1-year-old. So they're all spaced out nice and far.
Yes. Yeah, you'll never be at the same school.
No. Well,
probably,
actually, so my kids, my 7-year-old and my 14-year-old, they are on the same campus at least.
Okay.
So the high school is right across the street.
That's
which is
pretty cool.
really nice. So they do, sometimes they'll see each other like in the lunch room, like as they're passing, which I think is really cool because typically in like a normal school setting, they would never see each other. But now she'll be like, I saw Camden at lunch. And I'm like, oh, that's so good. Did he give you a hug? She's like, yeah, he gave me a big hug.
Oh, and that makes her feel so special.
Yeah,
that's so cool.
It's really sweet.
Some comfort from home at school.
For sure.
That's huge. My sister also has like super spread apart kids. Kind of. Well, she has a 6-year-old, 9-year-old, 15, and 20.
Yeah. Wow.
And me and her are 15 years apart.
Yeah.
But that's my favorite relationship, I've always said.
Oh, cool.
So someday, once they go through all their things, not that the relationship's bad now, probably, but like in adulthood, that's going to be really sweet.
Yeah. I'm looking forward to that. Like they all do. They love each other so much. They're just all in a different season of life.
Yeah, exactly.
There's, I think, pros and cons to having kids super close together and having them far apart. For us, each one of them got to be the baby. Like they each had their moment as the baby, which I think is special. But then I have my bonus kids that kind of fill in all those gaps.
Yes.
And it's really, really sweet to see them all just like play together and, they're interested in the same things and they all want to, I don't know, it's just easier to create activities, I guess, for all of them when they're closer to the same age. So there's benefits to both. Either way, I think whatever works for your family is just what you do.
Totally. Right now, one works for me.
Right, exactly.
One is quite a bit
if
for
you
me.
ever need play dates or like little buddies, I'll drop a couple off for you.
Cool, yeah.
You can send them back when you're done.
I have no furniture for that reason.
Right.
I do want to be like the fun house, I guess. With, of course, with boundaries,
right.
but the place where everyone wants to like come hang out, because I don't want to miss out on really any moment of that. I think about that already. Like my brother's kids, 15, and he gets them every other weekend. But like at this age, he's got plans every other weekend, So my brother's like, hey, you got to hang out with me.
Mm-hmm.
But they're so go at that age. He definitely respects him keeping his like cool persona and lets him go do all that. But I'm sure it's a challenge because he also has a newborn, born in August.
Mm-hmm.
So he's got one that's like there
Mm-hmm.
and one that's like, wait, no.
Mm-hmm. And I would literally, I say this all the time, having a baby is easier, like parenting wise, than having a teenager.
Oh yeah, they just
Having
stay
a teenager,
right there.
yeah. Well, just and just like the things you worry about, and like
especially this world,
navigating boundaries, but also giving them some freedom so that they hopefully don't go and rebel, and wanting to keep those open lines of communication
and get in social situations where they can learn but don't get hurt.
Right.
You're like, how do you keep them at like this?
Right. You're
like a little string, but
giving them some it's challenging, but it's good. And then I really think having the smaller kids at home helps preserve some of that childhood feeling for him too, because he, then he sees his little sisters and he wants to.
He's like, oh, let me backtrack.
Yeah.
Let me slow down.
Yeah.
That's why I talked about this with my sister. Like parents are always unintentionally, really, just because how the world is rushing. And I'm sure you own a business, one that cares for others. I believe your husband owns a gym. So y'all are both very go as parents. There's 6 total kiddos watching y'all. But I think just saying all the stuff I've said so far, like y'all are doing an amazing job. Y'all are like setting such a good foundation with ethics and healthcare. Y'all are both focused on preserving one's health and self. Yeah. And that's so important at any age. Right. So I think that's incredible. I know I've always looked up to you as mom person, just anybody in those like quick 15 minutes that we get. I would like be like, oh man, I can't have too many questions this time. But I always came in with so many questions when I was pregnant. I think when you're pregnant, I definitely wanted to get in this. I'm glad we're getting into it. You're looking for resources. Yeah. If you're not on the internet, people support is resources. Your parents letting them know what you're going to need. Breastfeeding alone. Yeah. And I think that I've always called Flourish a one-stop shop because you have lactation, you have massage, you have chiropractic care already. I love at your very first appointment there, you go and you do a thermal scan. Yep. I'm trying to get all these.
Literally, I'm really impressed.
Last night I've actually got a couple chiropractors in my family. Oh, cool. One that literally is graduating really soon. That's just passed his boards. Cool. Shout out Sean. And I've always been in it, and I've danced my whole life.
Yeah, that's right. I remember that.
So I knew when my body hurt. My dad knew where to take me, and I think that's so cool too. Thank you, Dad. But it was like a sports place, so that's why I know that it's like snap, crackle, pop. Right. But y'all have got the thermal scan, so you start there. Can you explain like the scoring of that? Yeah, it's really cool. Lennon did it too, so any age can do this.
Yeah, we started at newborn because we want to see how their stress level is, or how their stress is kind of distributed through the body from day one.
Birth is traumatic.
Birth is traumatic. It doesn't matter if it's perfectly normal home
they were
birth,
chilling and
easy,
they weren't.
Right. Or if it's a, emergency C-section, whatever it is, birth is traumatic for babies and for moms. And positioning in utero, like they're stuffed in there for 10 months. Maybe they're in a great position the whole time, but maybe they're not.
Yeah. It's all they've known, at least.
Right. Exactly. And then their body adapts to that pattern. So the thermal scan is thermography. So it's sensing for inflammation, essentially, deep within the spine and nervous system. So it's looking for areas where the body's really holding on to tension. That's going to translate to interference within the nervous system. So that can cause the baby to go into, or anybody to be in more of a fight or flight state. It can cause, of course, pain and, muscle tension. That's kind of like very surface level, but it definitely does that. Aches and pains. And so we're looking at this image to say, okay, this is the pattern that your body is currently experiencing. This is the stress pattern that you're stuck in. we'll start our series of adjustments or whatever the therapies are that we're recommending or that would be most suitable. And then we can go back and see changes. So then we'll redo the thermal scan, usually at like 6 or 8 weeks. And we'll literally see the nervous system start to wake up in areas that it wasn't active. We'll start to see that stress distribution become more symmetrical. And in turn, outwardly, we'll see things like less colic or better mobility, like a baby that's super, super tight now is resting and moving. And
improved nursing.
Absolutely.
I know. That helps. Lennon was a super, I guess, colicky baby, or he had like a witching hour. 6 o'clock was wild for me every day. And the only thing that would help would be like really loud rock music. But I
remember that. You were like, it's fine. It's fine.
We're just going to turn on his head.
Heavy metal. I'm like, okay, hey, it worked though. He was like, okay, thank you, Mom.
He was like, cool. I just need my music.
I love that. That was so sweet.
But you know what? I'm glad I found something at least. There's a lot of people who just have to ride it out.
What do we do? Yeah.
Yeah. I've had, people ask me that. But I don't know much about because I've known like formula babies to have it. And I'm like, I don't know much to help with that. But I know that they have to find their right formula. Some have, I hear a lot of my friends use the soy one where they have like tummy problems. But I know chiropractic care definitely helps with that too.
It does.
I mean, some Dr. Toe, I think y'all posted a video where a baby's like literally passes gas or poops mid-adjustment because they finally feel like,
yes. And that's exactly what happens. You will see them or audibly hear them be like,
yes, like and they just release.
Yes. And then they go from that fight or flight stress into that relaxed rest and digest.
And I think that's so cool. We started, Lennon started at 8 weeks there.
Yeah.
Once I could basically get back in the car, that Duna was heavy. So
seriously.
I talk about the Duna all the time.
So convenient.
They need to sponsor me.
They should.
I'm like, and anytime I see someone using a Duna, at this point, y'all should know what it is. So I'm not even gonna describe it. I'll just like drop a picture of it. I'll see one at the restaurant because I'm serving. I went back to work September 1st.
Okay.
And I'll see like a family walk in with that, and I'm like, what's up?
Yeah.
You know comfort, but you also are a bodybuilder.
Yeah, exactly.
In order to throw that. And I'm like, and I'm small. I had a C-section. I was like doing probably what I shouldn't do, but we were getting out of the house finally. And the first place I went was Flourish.
Oh, really?
Whenever I got out. Yeah.
Cool.
We went there and I went to church.
Yeah.
Yeah. I was trying to fill my heart, my soul, and my body.
I love that.
Just trying to get better.
Right back into like the self-care, the healthy mindset. I love that.
Oh yeah.
That's awesome.
It's it's, and I talk about how it's kind of been a burden. It's kind of been, I mean, whenever you don't naturally focus on yourself, it is going to sound like a burden to stop and do something for yourself.
Yeah.
So I guess that's more so something I'm working on like mentally, because it's really not a burden to take care of yourself. It shouldn't be, but for a mom, it can be.
It feels that way, right?
Because you're always caring for others.
But how can we truly care for others in our best way if we are only functioning at like 60%? Like if we are run down, exhausted, completely drained emotionally and physically, how can we possibly be the best version of ourselves for our kids or for our husbands or for our households or whatever else? And so that's something I'm also super passionate about too. It's just like postpartum, what are we doing to take care of mom along her breastfeeding journey, just along her healing journey? How are we supporting baby through that to help both of them be happier and healthier at home too? I just think postpartum care is like super, super important. And our country, honestly, is terrible at it.
Terrible.
Really bad.
I see like, and you know what has made people realize it's terrible? Social media.
Yeah.
Like you see, I watch, whenever you're stuck breastfeeding, we're at month 15. So
amazing.
I have been stuck on my phone for quite some time, and all I do is, research and see these different countries, and leave is like 3 months minimum. I think what they say, one of the best countries is like China.
Interesting.
they have a nursing room and like as far as that goes, like they really acknowledge the youth of their population and that they will, I don't know, what they care for moms, even if they might not care for other things. They definitely have things that because it's a no-brainer. I think.
Right?
I think for other people, it's a no-brainer. For America, it's like it's not profiting me, so what's the point? As soon as if a man had to do it, we'd have paternity leave so fast, so longer, so all those things, right?
Yeah. It's crazy. It's so crazy. They're like, you just had either whether it's a major abdominal surgery or a vaginal delivery, and they're like, all right, baby's here, mom's
Same
still alive.
6 weeks.
So like, we're good. See you later.
We did it.
Have a knee surgery though.
Oh yeah.
You're going to go straight to PT for 6 to 8 weeks.
All the things. My mom had a knee replacement, and yeah, it was like a year-long process of care.
Right.
Basically.
But just birth a baby.
Oh yeah.
You're fine. You're good.
Rub some dirt in it.
Yeah. You have a wound about this big inside of your uterus.
No big deal. Yeah, that was wild. C-section was wild. Especially whenever it came down to like, 10 eyeballs looking at me, like heart rate's dropping. What are you going to do, mom? I'm like, I don't know. I've never, obviously I have to get him out. Like, I don't know what paper do I have to sign, and they're like having you sign papers and they're like, you're just like hearing your like babies going, going down. He came out fine. He's great. And turns out he came out fine. So I was like, relieved immediately, but also knew while signing those papers, I was imagining my postpartum journey right there. Yeah. I knew what I was signing. I knew what I was signing over. Really for life. I try to like flex my abdominals to do anything. And I'm like, ooh, why did that pull at my hip?
Right.
Like, why did my skin move? Like, that's wild.
Yeah. It's crazy.
No one's going to tell you that or whatever, unless you literally, and nobody also talks about even pelvic floor therapy.
Yes.
So you need to you get your resources. That's what I'm talking about is like, you actually introduced me to Brittany and Empower Pelvic Health, I think is their name. I don't want to butcher that. So I've seen both of y'all before and after care, trying to get a regimen of how to remotely work out and move my body again. I went back to serving. I have a 15-month-old and you saw he's pretty active. So I'm trying to, refocus and, get back into your office. I am literally actually have an appointment at 3:45
today.
Yeah. So if we can hurry this up, I'm joking. This is like 9 a.m. I have my first bout of mastitis. I have never, and you know what? After one Google of like just a picture, because it's just like, it's your boob and one red dot. And I was like, oh goodness, what is this? And I've never, but I didn't have a clogged duct.
That's good.
Like there's nothing like that going on. But we were messaging about coordinating this. And I was like, oh my gosh, you wouldn't guess. I'm having the best day ever. I have mastitis. And you're like, wow. And I remember at your one-stop shop that you mentioned, and you had heard that I was like, yeah, I'm nursing. You're like, oh, mastitis ever shows up, come here. And I was like, cool. And got an appointment that day. One of your assistants is able to do that. So I don't have to get like a doctor block. Right. So I can come in at my convenience. And it's like a 10-minute thing. Can you explain what it's helping? It's inflammation.
Yeah, exactly. So, and with mastitis, sometimes it does start with a clog. I'd say pretty often it does.
Yeah.
So I even start telling moms, like, I always recommend just doing some self-checks at home, like daily. Just make sure you're not feeling any lumps or bumps or feeling really stuck in there. Try to do some self-massage at home. But if that doesn't work and you're getting clogs and or mastitis, what we'll do is called ultrasound. So it's not a diagnostic ultrasound, it's a therapeutic ultrasound.
Yes.
And so it's different, but what it does is it sends sound waves into the tissue and it vibrates the tissues really, really fast. So it helps to kind of disperse inflammation. And also if there's a clog, it breaks up that clog like immediately.
Yeah.
a lot of times it'll cause a letdown actually, and then you'll see, some of that clog come out.
Yeah.
So it works really well. It also decreases pain because you're dispersing that inflammation.
Mhm.
And then every now and then we'll do a cold laser treatment as well on that. And the cold laser helps with just healing that tissue a lot faster. So this way we've been able to help moms avoid like antibiotics and helping get like
Yes.
a full-blown infection where you're miserable and you feel like you have the flu. We're actually just treating the like issue.
In my quick research on I'll just like throw words into the search bar on Instagram and like see what comes up. And because Google's so censored.
Yeah.
Like won't.
Instagram's the new Google.
I
right?
won't go there. Yeah, I won't go there. Or I'll message. I've got, pretty good relationships with doctors I do trust.
Yeah.
That I'll message or, and I had actually great success with this yesterday.
Yeah.
I'm only going back today to like, end it.
Just make sure.
To make sure. Yeah. Because I know like it's not a cool pain.
Right.
I didn't have any flu-like symptoms. Thank God.
Good.
But as soon as I put that in Instagram, I want to say the first 6 reels or slides were you don't need antibiotics for mastitis. And I was like, oh, awesome. Because I definitely don't want to do that.
Right.
I'm avoiding it for me and for him.
Yeah.
Because I don't want to breastfeed on antibiotics. I don't know what it would do.
It will mess with his gut.
Yeah. And I know it would mess with mine. I would be in the bathroom for the rest of the day.
Oh, yeah.
And I'm a mom. I literally can't be in the bathroom longer than 2 minutes.
Yeah. No one has time for that.
I don't have time for that. So I, got in my car after his nap yesterday and was like, bye, I have to go do this.
Yeah.
And I got an adjustment too, because I feel like if my body is fighting off something, nervous system needs to be aware of
100%.
it quickly, because mastitis can turn bad within like 24 hours.
Right. Exactly.
It's fast.
Yeah. So having it being in, getting adjusted at the same time is super important. So it's going to make sure that the nervous system is getting that good communication to that part of your body so you can heal faster. It also can help sometimes elevate the immune function as well, so that if you are fighting something off, your immune system is activated and working like it's supposed to. So the nervous system is everything. If your nervous system is compromised or if there's interference around that nervous system, you're going to see deficiencies in other places. So if we keep the nervous system functioning like it should at all times, then your body's going to operate at a much higher level, helping you fight off whatever it is or deal with whatever stress that your body's under.
Yes. And I've been, listening to that, taking that in. And I'm like, also, I'll probably take Lennon to get a chiropractic adjustment before we go to the pediatrician ever.
That's how I grew up.
Okay.
Like, that's why I am the way I am.
I don't know. But like, you see my not wanting to say that because like society's like pediatricians so quick, like that's the end all be all. And I like my pediatrician. Do I ever want to be in there again? No.
Yeah. I think like all doctors have their places, right? And there's not one doctor who can do everything. And so I think that we definitely need, like I said, all the different types of doctors. We need a team. But there are more natural, gentler, less invasive ways of making sure your body's functioning like it's supposed to and keeping our babies healthy and watching for milestones being on track, taking care of things like flattening in the head or trouble breastfeeding.
I was going to talk about that next, actually. Y'all definitely helped me with, or I guess helped Lennon with his head shape.
Yeah.
He had very much birth trauma. I was like, no pictures without a beanie.
Yeah.
His head was like going off into another atmosphere.
Yeah.
Because they restarted my labor like twice.
Wow.
And like when I say restart, like flipped me upside down type of thing. Yeah, this was, I don't know what was going on.
I don't know what was going on either. Like, what are y'all doing?
I don't know. I was like, I guess we're still doing this. It was 40 hours.
Yeah.
It was a 40-hour experience before the big finale.
Wow.
It was a bit much. Yeah, I'm definitely going to have to go through a lot of therapy before thinking about a second one. Because, yes, it could go great and different and all that, but it could also go the same way.
Yeah.
That's the unfortunate thing. And I got to find a doctor that would be cool with a VBAC.
I know some.
Okay.
Yeah. I'll send you some
Mine immediately
resources.
told me, no. And I was like, okay, we'll have a good one.
Yeah. There are some other things that yours told you during your pregnancy too that, you would come in and tell me and I'd be like, I don't know, Sydney. I just don't know about this guy.
And the thing is,
But-
I didn't know either. That's why I came to you. I was like, okay, thank you.
Yeah.
Yeah.
Yeah. But no, we have lots of resources. And one of the great things about living in Greater Houston is that we have so many options.
There's a great medical center.
Yeah.
Yeah.
So many options. And I have tons of moms that come into the office who have had 1 or 2 C-sections. And then the next birth, they're like, I'm done with the hospital. I'm going to go with a midwife, which is an out of a hospital experience, whether it's a birth center or a home birth. And I'm like, well, that's a big change.
Love to hear your experience. Because I think,
and then, so here's the thing with midwives. They are like, the level of care is so different. They're going to be monitoring you and not just like, okay, every prenatal appointment, the nurse comes in, checks your blood pressure, listens to baby's heart, you do a UA and you're done. Like they are going to sit down and talk with you for an hour. They're looking for red flags. They're going to be co-managing with maternal fetal medicine if they need to. Mm-hmm. They've got medical doctors on their team that if something arises or if there's any type of complication, they have got the in with that person. They've got plan A, B, and C, like already set up in place. So they're super organized and it's just an incredible experience. So, it's not off the table for people who have had C-sections in the past, but there are also great OB-GYNs who are totally open to VBACs also. And so that way you are in a hospital setting and, you've got all the monitoring there too.
I know that a lot of people, they definitely, they do want that hospital setting.
Yeah.
But I mean, nobody's like, I want a C-section, I think.
Well, you'd be surprised.
Actually, yeah. People are, there are some.
Yeah, there are some. But, and so every mom is so different. Every pregnancy is so different. Every birth is different. Yeah. Every baby is different.
That's why I'm like, I just need to process this one and I'm sure I'll have a beautiful time next time.
Yeah.
You know what I mean?
I'm sure you will.
Maybe God will.
The chances of having the exact same experience again, I think are very low.
Yeah.
Just from my experience of working with tons of different moms who've had lots of babies, rarely are 2 pregnancies and deliveries the same. Now it could be, absolutely it could be, but
I think that's just my like hypervigilance having to like, I mean, last week I was just in the last episode, my overthinking went to, I have to, I'm preparing myself for my daughter-in-law. Like I was while my kid's 15 months.
Wow.
So,
true though, right?
So like, I'm thinking of all those things. And then especially thinking about another baby, I'm like, man, pregnancy was hard. Man, labor was hard. Like, I'm like, oh man, women really go through the ringer for this. And awesome experience. It's everything.
Yeah.
It's everything. And I mean, I'd love to, I also would love my nursing journey to be the same again.
Yeah.
But I also understand that might be different as well.
Yeah.
And so I'm just grateful for every day I do have doing that. And then I got to stay home for the whole first year.
Which is amazing.
So that was super cool. And even now, I mean, I'm serving tables, but the reason I think I got mastitis was I thought, because we're gentle weaning.
Yeah.
But it's still on demand when we're at home, it's still on demand. If he's asking for it, I do not say no.
Right.
He's far too young for that, in my opinion. My goal is 2 years. I'm not really trying to stop that soon at the moment. But it's a gentle wean. So I thought for my 6 hours at work, I started pumping the first month. I would pump once. And then I was like, I don't have to pump. So I just worked 4 days in a row, 6-hour shifts. And this one's my like oversupplier. Mm-hmm. And then all of a sudden red streak on by Sunday, I had a red streak on here and I was like, I need to be pumping.
Yeah, definitely. Yeah. Cause your body's just trying to figure out what's the frequency.
Yeah. Someone told me, no, you'll be fine. That won't happen to you. But that same person also was like, sometimes I have to hand express. And I'm like, well, that's at an emergency level. Right. Once you're at that point, and you're uncomfortable, like then you should be pumping.
Yeah. You don't want to get to that point.
Yeah. So, no, I have a little hand pump in my backpack right there. And I just carry it around in some Tupperware.
Yeah. Perfect.
And pump when I can. My bosses are great about it. I just like, I was never a pumping mom.
Yeah.
So,
it's the worst.
So starting,
I have so much respect for exclusive pumpers because I'm like, oh gosh.
My friend Victoria, had to go back to work at 6 weeks, I think. And then her daughter went to daycare, and pumped the whole time and still pumping. Her and her baby and Lennon are 4 months apart. She'll be a year in December, has pumped this basically this whole time. She'll latch a bit, but because the baby does still latch or will latch, but bottles mainly because of daycare. And she did what she had to do. And she's a hoss, really.
Seriously.
I have high lipos.
Okay.
Or I don't know how you say it. I don't know.
Uh-huh.
You know what I mean. If you have it, you know what I'm talking about. So I couldn't pump, freeze, and prep anything. And I'm a big prepper.
Yeah.
So she actually donated some milk to me whenever Lennon, I was going back to work, and I didn't have milk. I couldn't pump. So I didn't have anything ready yet because I hadn't started pumping at work because he has to take it fresh, obviously, if I'm going to do anything at all. So sometimes the milk I pump at work even just as bath milk because I can't do much with it.
Yeah.
And I'll tell people that at work because they'll make jokes. They'll be like, can I take a shot?
Yeah.
And I'm like, the serving industry is so inappropriate.
Yeah.
And I'll be like, I should sell this.
It's like a Netflix documentary on the underground. Oh my gosh, it's so funny.
The Underground Railroad of breast milk, of lactation services.
Yeah.
Or someone will be like, can I put it on my skin? And I'm like, honestly, please do, because I can't do anything with it. And I worked very hard to make this.
Right. Absolutely.
So please.
Yeah, absolutely.
It's like making a cake that no one gets to take a bite of.
Yeah.
And it, life-saving stem cell cake.
Seriously. Yeah, exactly.
I'm like, please, no. And they're like, oh no, I'm joking. I'm like, okay, whatever.
You're lost.
You weren't down for it, but you should be.
Yeah.
There's I saw something that bodybuilders are trying to buy some now.
Yeah.
Because it has
growth hormone.
Omega. It has a bunch of different omegas in it too.
I mean, honestly, it's just the most perfect food there is.
And it's catered to your baby. That's awesome.
Right.
And I don't have to clean a bottle.
Right.
So that's pretty chill.
Yeah, exactly. And that's what I talk to moms a lot about in the office is when they're struggling with nursing in the beginning and, you can tell they really, really want to do it, but they're getting so exhausted. It's once you get through the hard part, it's so easy.
Yeah. I felt after 3 months, I was, and there's the supply regulation at 3 months that makes a lot of people think that their supply is depleting or something.
Yeah.
And that's common too, but it's common that people think that because we're not talking about it.
Yeah.
You're the one who told me oh, well, your estrogen's trying to go back to what it was. And I share that with so many other people. A lot of things that I'm sharing with other moms, I'm literally learning at your office.
Oh, that's awesome.
Actually.
I love that.
And I know not a lot of people are, fortunate enough to find these resources or didn't have the time and they're in the situation right then and there.
Oh, they don't know where to look.
Yeah. And I'm fortunate that these people trust me to reach out to me and be like, hey, what are you doing? Blah, blah, blah.
Yeah.
And I don't have any experience with my kid being sick.
Yeah.
Because he was sick for 24 hours. He had boogers. I nose freeded him and we did boob all day and skin to skin. And that was it.
It's amazing.
It was over. I did silver, which a lot of people don't know about either. Yeah. I took that also for mastitis because of infection.
Yep.
And my sister, that's the first thing. She's the queen of, I put that on everything. Yes, yeah. She has the 64 ounce.
I was just going to say, I have a big old jar. Actually, I have the big jar. And then in all of our cabinets, because I'm terrified I'm going to run out one day. So I have the nose spray in one cabinet. And then,
I
the droppers in
have
another
the
cabinet.
cream or
It's amazing.
Last time I got bit on my nipple.
Yeah.
I used it, the cream on there and it worked.
Love it.
Bites are horrible.
Oh gosh.
But you take your mind somewhere else and you keep feeding them because your supply will drop if you don't, and you just keep pushing forward.
So with my 7, so actually the only one that bit was my 7-year-old, and she was super, super sleepy. And we were nursing. It was one of those nights that she just couldn't sleep, but wanted to sleep. I don't know if she was teething, probably so. She bit me. But anyway, she bit me so hard. I literally screamed because I thought Like I thought once I got her off of me, I was not going to have a nipple anymore. That's how hard she
you
bit
were like,
me.
it's over.
Like I was like, that's it. There's going to be blood going everywhere. Like there's no more nipple. Like she just ate it. I don't know. And so I screamed, and then she's cried even harder.
Yeah.
And so I scared the crap out of her, and then she never bit me again. So I'm not saying like
My
that's
sister
how
said she had
it.
to like do the same thing.
But it wasn't even intentional. It was just like that was my response because it was so painful.
Lennon thinks it's funny.
So that works. Right.
Yeah. It's so I'm actually in my own little level of hell.
Yeah. So Violet, she will bite me like just recently when I'm trying to rock her to sleep. Like when she's really something about when my kids are really tired, they want to start biting. But she'll like bite my shoulder or bite my neck. Like I'm holding her and she's gonna bite me. And so I'm telling her like, no. And then she thinks it's funny. So I put her in timeout, right? Timeout.
Yeah.
Which timeout is I put her in her crib and I'm like, okay, no biting mommy. And then of course she like loses. She like lost. I did this once the other day. I told my husband, I said, I put your baby in timeout. And he's like, you did what?
In her own crib, in her own comfort of her own home.
And so anyways, and so I let her, like it was like 30 seconds or a minute. I stepped right outside her door. I came back in and I said, I will rock you, but you cannot bite mommy. And then I don't know, it worked. So maybe she just like, maybe she figured it out.
She's so smart.
I don't know, but I'm like, dude, yeah, it's painful. Their little teeth are razors.
Yeah, that's what that's kind of the first thing that people say whenever I say how old my like kid is and we're nursing. They're like, doesn't he have teeth? And I'm like, yeah, and he eats 3 meals a day with them.
Yeah, exactly.
Yeah.
Exactly.
And it works great for what that is. Right. But what's your thoughts on nursing at night and the care of that? I think that the nipple goes a little too far, like as far as these front teeth go. Lennon was born like I guess born with it because how it came out is how it came out. He's got like this like one tiny like chip right here.
Yeah.
And for a moment I was like, my sister had her son who they told her that because she nursed at night, he had to get 4 teeth removed here
because of the decay. So my dentist friends would say, my holistic dentist friends would say, the decay is more related actually to tongue and lip ties than to nursing at night.
Yeah, I heard it's more so hereditary and their actual diet of their solids.
Okay.
That's what, or if they're bottle, because the nipple's different and it can get to the front of their teeth if it's a nipple.
Right. Yeah. But I think if they're tied, so like I have one little girl in the office and I know hers was from a lip tie and it was her front teeth here. And they did the dental work and she's better now. But it was like because of the tie, she was holding too much food up in that area. So then the food was essentially decaying the teeth.
Yeah.
And so that's
the acids and all that stuff erodes it.
Yeah, exactly.
Okay.
So I don't know. I mean, I don't think there's like a hard answer, but I can't wrap my head around the idea that like it would be because of night nursing.
I still, as soon as he wakes up, we just got in Risewell toothpaste is what I started doing for him. Because it's remineralization toothpaste. Okay. And I feel like if any decay is happening, it's because of loss of minerals of some kind.
Right.
So, because at that age, it's not like he doesn't have like bad breath or like normal, like, I don't know, adult teeth issues. We don't floss yet.
Yeah.
He's got 6 teeth.
Yeah.
They're all in the front. I can see them.
Yeah.
He enjoys brushing his teeth for the most part. So as long as I made sure I got something that I felt like would rebuild if there is something going on. There's no discoloration, anything like that. But for a second, because of my sister's experience, and I just know how horrible her mom guilt was. I was in that dentist office with her son while he was, Johnny, forgive me, I don't know how old he was, but it was young. It was like, I want to say 1 or 2, like, and they grow back. It's not about aesthetically like what they look like in their teeth. Of course they're gonna have gaps in their teeth at young age. It's more so I feel like doctors were kind of guilting her like, oh, because you night feed, blah blah blah. And I'm like, logistically where that nipple is going, it is bypassing that. So as long as you hear your kid when you unlatch and they go, he like swallows.
Would it only be at night? Like you
Wouldn't
don't
it be all
change. Yeah,
day?
exactly. Like that's what doesn't make any sense to me. Like really, if we think about it,
Yeah.
the mechanics are the same whether it's nighttime or daytime
This is
feeding.
probably like, not big farm, but big sleep.
Yeah, exactly.
They're so obsessed with like the first thing my pediatrician would ask, like, where is he sleeping? And I'm like, well, first off, he looks great. Thank you. Like
Right.
he looks
His
like
head shape is round.
he's growing. Yeah. Everyone was like, oh, he's beautiful because he's a C-section baby. I was like, no, we worked on that head.
Yeah, exactly.
We worked on that head
for that. Yes, exactly.
we did. He looks great now.
Yeah.
He's great.
Yeah.
But the teeth thing just randomly gave me like a panic attack not too long ago. So, I ordered the toothpaste, and not that I wasn't using toothpaste, but I feel like I'm such an ingredient person at this point that my anxiety saw even non-fluoride toothpaste. I saw titanium dioxide and I flipped. Yeah. And I was like, no way, I put this in my baby's mouth. Yeah. So now we're on to remineralizing things.
That's cool. That's good.
Yeah, I don't think it tastes very good though.
He doesn't know. Different. Yeah,
he just likes that I'll brush it, and then I'll give him the independence of, he gets to carry it around the house and like bite on it and think he's brushing his teeth. I'm sure he's just rubbing it on the wall or something when I'm not looking.
Enjoying it though. So
I have to change his toothbrush so often. Fertility. Yeah. I wanted to get into that. What's cool also is I get emails all the time from your office, and it's nothing but education. Yeah. And it's nothing but, and I click every time. Yeah. I have 30,000 emails that I have not opened, but every time I get a Flourish email or an Empower, I definitely look and, see if I can learn something. I love an informative podcast. Yeah. I always say that. I love to laugh. I'm a big comedy person. But if I could learn something, I feel if I could grow at this age as a mom, if it can help me in my journey, if I can help someone else in their journey, stand in solidarity of any kind, I'm looking for it. Totally. I'm craving it, if anything. Right. That's why started this.
No, so fertility is huge. So we work with a lot of moms who are struggling with fertility for a number of reasons. And with everything we do, we want to get down to like the root of what's happening. What can we do to support your body so that you can function at your peak?
A lot of times it's stress.
Stress is huge.
And I feel like chiropractic care definitely helps with that.
Yep, it does.
It lowers cortisol.
Yep, that's exactly right. You're taking the words out of my mouth, Sydney. No, you're exactly right.
This is what I say to like other people all the time.
It's true.
Because I feel like whenever you live so differently than the average American, and not even saying like, oh, I live so differently. I live in a tiny apartment, but I don't live conventionally.
Right.
I'm a server. My fiance's a musician. We are off on Tuesdays. Yeah. Random days. Weekends. We're weekend warriors, what I call it.
Yeah.
I believe in chiropractic care. I believe in holistic medicine. I will bash Bill Gates any day. Just all those things where you feel so different. You feel like, same with Christianity, I feel it sometimes. You're constantly defending something that doesn't even really need to be defended. Like, who's mad that you want to live at peak conscientiousness and at your best health? Really, if you think about it. There's a lot of
people mad about
but
it.
They're mad about
they're
it.
Mad.
But they're so mad.
I feel like I went through that. So I started my journey. Well, I went to chiropractic school when my son was 10 months old.
Okay.
So he's 15, about to be 15. Okay. Then he was like not a healthy kid. Like while I was in school, he was asthma, chronic ear infections, ear tubes, like all the things. This is before.
Ear infections are so common.
Yes, before I knew what I know now. And I was doing all of the typical like major medical, like this is what you do, right? Mm-hmm. All the things, whatever the doctor told me to do, that's what I was doing. I was young. I was, like I said, still in school. Mm-hmm. I had graduated from undergrad, but I was just starting my chiropractic school.
We're young. We don't have those resources yet.
And one day he had a scary reaction. And in my mind, I was just like, this is not right. Like what I'm doing is not working. My kid is not healthy.
Yeah. God gave you that discernment right there.
Right there. I was like, something's not right. And I don't know what it was, but then all of a sudden I just started to like digging into the chiropractic kind of wellness, like nervous system, immune system. How can we support our bodies instead of like all this external junk we're putting in? What is that really doing? And so truly, like my son, he is the reason, number one, why I became a chiropractor. And then number two, why I raise my other kids the way I do.
Yeah.
And why I've learned so much about how we want to live differently, like you were saying, than other people. So in the beginning, I felt really defensive, and I felt like I wanted to tell everybody, and I wanted to prove to them, or I wanted them to understand why I was making the choices I was making. And I wanted them to almost like support me in my choices. And I never got that from some people, like even in my family. And so I finally got to the point where I was like, you know what? I'm going to do what's best for my family. And I'm not going to talk about it to anybody else unless they ask. Like if somebody genuinely has a question. So like in my office, I'll have moms ask me every day, what do you do about XYZ? And I'll sometimes like take my doctor hat off and put my mom hat on and say, okay, as a mom, right, this is what I do. And this is the choice that I'm making, but you have to make the best choice for you and your family. And so that's kind of where I found my peace, is that, you know, I'm open if people want to have a conversation, but also if they're, you know, I'm not going to like go out of my way.
Yeah. That setting also does teach you to not censor yourself, but you definitely have empathy for everyone who walks in the door.
Absolutely.
Motherhood is hard enough.
Right.
You know, you learn how they're parenting, and you're like, you know, whether you agree with something or not. And it's not even that you disagree. You just wouldn't do it.
Right.
You know,
and, you know, I feel like there's, when you become pregnant, you start making decisions for you and your baby. And then that never stops. You're just going to make decisions every day for the rest of your life,
literally,
regarding
and then they start eating food.
Your baby. Yes.
And then it just heightens.
Crazy. So
more and more.
I always tell moms, like, whatever you decide, you have to feel comfortable in your decision. And then you made the right choice. So like, as long as you are, you know, making an educated decision and you're comfortable with it, then you made the right choice for you.
Yeah.
And that's like what it comes down to.
100%.
You know?
Yeah. I mean, as long as the baby's happy, thriving, whatever.
And you feel good about what you're doing.
Yeah. I feel like,
then you're good.
Yeah. We definitely need more moms who just want, friends who want your baby to thrive.
I know.
Whether it happens their way or not.
Exactly.
We definitely have some generational curses in America that we're fighting every day. I'm so blessed that my mom never breastfed, but she's definitely every step of the way open to learn. Even yesterday, we're just talking about what dialogue we're going to use with Lennon. And like how we're going to, you know, uplift his spirits, how we're going to teach him respect, how we're going to make him feel like he's making his own choices sometimes. Because she watches her and my dad watch him when I'm at work and Tommy's gigging. Because we both, Tommy and I both try to work at the same time. So when we're all together, we're all together. So he'll go to my parents' house, and I definitely, I'm learning how to like talk to other people about my boundaries and stuff. I don't necessarily think as a child I got the dialogue, but I think it's because, not that I wasn't taught it, I wasn't put in the situations where I had to defend it. I was around a bunch of like-minded people. I grew up in the same city my whole life. I'd never had to face much adversity until college, and especially becoming pregnant, because everyone loves asking dumb questions. And then I'm like, oh, okay, I have to have rebuttals. I have to know what I'm going to say, what I stand for before this baby comes out. And that's kind of when I got into like hyper, I don't know, mode, getting my resources together.
I loved it, because I think when you first reached out to the office, you were like, I want to start care with you because I want to start care for my baby, but I want to start with me Like, I know it's really good for my baby when he's born.
Yes, that's what
I want to start with myself now.
I did a phone interview.
Yeah.
I think
Or
before
consultation.
Yeah, consultation. Yeah, there you go.
Yeah, that's what it was.
Before, and so I met you over the phone, and then I was going to do an appointment no matter what. Yeah. But that phone call definitely solidified a lot of things for me. Yeah. And then that appointment definitely did, because I had my notes and you were like hitting me with these absolute banger of facts that I don't know if I remember it. You told me about the 1986 bill. It was a bill, right?
Yeah.
That Ronald Reagan, or what president?
Oh gosh.
Anyways, they made it to where vaccine companies will no longer be held liable for the junk that they put in there, whether you're able to prove it or not. Yeah. It'll be a settlement forever, basically. And then after that, I was like, okay, well, it's after 1986. And I gathered myself that in order to make these vaccines more profitable, cheaper, mass production, they probably added more stuff to it to dilute whatever they had to do. So then that's when I gathered my own decision on that. And that helped me. And if I could help any other mom feel comfortable in that journey, there's a little fact for you. Wrapping up here. This has been so quick and so fun. I was like, every time I like finish a talk with someone, I'm like, oh, I'm gonna have to have you back. Yeah. I'm like, because there's so much to get into. I think one more question I had about fertility was dads. Do you think it will help males as well? Because there's a lot of times we focus and we put so much pressure even on the female to be fertile, when men go through so much hidden stress that it's almost more stress because they hide it. Yeah, absolutely. Well, that in diet is huge. Yes. When it comes to male fertility. So, our American diet, especially, I don't want to be like sexist, but like, I feel like our men are kind of meat and potato boys, especially down here in Texas, right? Yes. Yeah. Meat and potato boys. My husband was the same way. He's a little bit better now. Yeah. No, I mean, their nutrition plays a massive role in their motility and the health of their, sperm. And so we talk a lot about that, about dad's health, dad's nutrition, dad's stress levels, dad's sleep. Is he working shift work? A lot of our guys down here work shift work. Yes. We have the union workers. Yeah. And that's really hard on their circadian rhythm, which affects hormones. And so there's a lot. Dads absolutely need to be healthy to make a baby. Tommy's just like never gotten a chiropractic adjustment. He's still a little skeptical about it all. Yeah. You can see it in his face. You know what? It's so funny. That's how dads are. Yeah. Men. That's why our practice is designed that way, but we're 90+% moms and babies. And then but it's Flourish Family. So dads get your rumps in there. They do. I'll tell you when they do. They get in when they're like crawling. I was about to say when they're miserable. My dad's had back pain for weeks, my mom said, and she's like, he really needs to go. I'm like, well, he needs to go to mine because it's not just going to be a snap crackle pop. Right, exactly. He needs care. And so, or they'll show up and be like, well, my wife made me the appointment. She told me I was coming. They can never be like, just like, I'm doing this. Right. It has to be like forced, like a kid. Yeah. And that's why married men live longer than single men. Because your wives will take care of you. I was about to say, like, I mean, I feel like just like the age of death statistics should just send you to the chiropractor. Just check that out and just go. Just check it out. We live longer. Totally. Because we sit down and we talk to each other and listen. Yes, absolutely. Yeah. Absolutely. Thank you so much for being here. One last thing. I also think one more thing about this one-stop shop. I also get my my flu medicine. Yeah, at your homeopathic at your place, and his probiotics. Yeah, and I have never used y'all are using Earthly. I saw the Earth Mama. Sorry, not Earthly. No, I use the Tea Tamer from Earthly. That's why I said that. But Earth Mama, the only nipple cream I've ever used. Yes, it's so good. It's also on my lips right now as a balm. Literally. And then that their butt cream.
Yeah, their diaper cream is so good. And they even have like just a baby oil, like calendula cream or oil, which is really good for like eczema and cradle cap. Just the skin, newborn skin is so, baby skin is so.
When it has some
sensitive.
like lingering cradle cap that I cannot get off. And it's been like a year.
Yeah, it's so good. And then they've got all these teas that I love. Like they've got like a heartburn tea. They've got a milk,
that's at the office.
Yeah.
Oh, cool.
Yeah.
I need to, I'm going today. But I'll check it out. Yeah, we've never used any other butt cream.
It's great.
I swear by it.
So
it smells so good
and it's
too.
so clean. Like I trust all of her products. I know that like what is in it is going to be safe for my kids.
And I don't know if this can be attributed to chiropractic care. This could be attributed to breastfeeding. He's never had diaper rash.
Yeah.
We've never had any issues. He's uncircumcised, never had a problem there.
Yeah, exactly. It's amazing, right?
Yeah. Isn't that crazy? We can get into that later. That's a whole nother thing. But as far as just talking about men go, just go to the chiropractor, listen to your wives.
Listen to your wife. Just every so often, just get a checkup.
Yes. And I want to thank you so much. Absolutely. I will see y'all later.
Yeah.
And y'all be safe. Happy holidays.
Yes.
And all of that.